Climate change is fundamentally reshaping our world. Sea levels are rising at unprecedented levels, while droughts are threatening the global food supply. The number of people who are likely to be displaced by climate change could also reach 1 billion by 2050. The climate crisis is also a health crisis, as rising temperatures and extreme weather will disrupt care and impact the health of our communities. Your local NHS organisations have joined forces with local councils to ensure everyone in the communities we serve has access to the best possible care and support. Together, we are the Coventry and Warwickshire Integrated Care System, or an ICS. As health and the environment are inextricably linked, creating a greener NHS does not mean sacrificing the quality of our patient care. It is about building new norms and weaving a green thread throughout our activities. One tool for us to follow this thread is our Green Plan, which will help us achieve the twofold task of reducing our environmental impact, whilst improving the health of our communities. The NHS plays an essential role, as reducing our carbon footprint involves actions that have positive health impacts. Our first target is to reach net zero carbon for all the emissions we can directly control by 2040, followed by net zero carbon for all the emissions we can influence by 2045. Our carbon footprint for the past financial year was equivalent to 258,211 tonnes of carbon dioxide, with over 1/4 of our emissions coming from sources we can directly control or strongly influence. To meet the net zero commitment set by the NHS, our ICS must avoid the equivalent of around 8,400 tonnes of carbon dioxide from all sources each year. To put this in perspective, it would amount to taking over 3,000 cars off the roads per year. Our Green Plan vision consists of 3 objectives. Net zero. Our targets for resource consumption and greenhouse gas emissions reduction are aligned to the NHS net zero targets. Our targets are aligned to emissions scopes, which categorise greenhouse gas emissions based on their source. Scope 1 emissions are from sources we directly control, such as fuelling our fleet vehicles. Our target is to reduce these emissions by 4% each year. Scope 2 emissions are from indirect sources, such as the production of electricity we buy to power our buildings. We aim to reduce these emissions by 5% each year. Scope 3 emissions are not produced by our organisation, but we are indirectly responsible for them. This includes emissions from our supply chain. We want to reach net zero carbon for these emissions by 2045. Climate resilience. We strive to ensure that our adaptation strategies strengthen our ability to maintain quality care and provide a basis for us to become a climate change resilient organisation. Social value. We want to ensure that our organisation considers the collective social well-being of patients, staff, and surrounding community in everything we do. We will now take you through some of our work to make this vision a reality. Our Green Plan features 9 priorities to assist us in reducing the impact on the planet. But what does our journey to net zero mean for you? Medicines are an example of creating greener norms across our system. Although switching to greener alternatives in medicines, such as inhalers, is recommended, this may not be right for some patients. We will offer training and support to our staff as they help patients to find the right inhaler for them. Green space and biodiversity are the green link between the surrounding world and our well-being. We are supporting healthier communities through green initiatives, such as wellbeing walks, tree planting, and creating wellbeing gardens in partnership with schools. As we offer vital services across numerous sites, Our estates and facilities play a crucial part in meeting the NHS Net Zero goals. We have made progress by continually working with our partners, upgrading to LED lighting, and installing renewable technologies such as solar panels. Digital transformation of our services through virtual appointments, digital workforce tools, and access to integrated care records lessen the need for travel and the emissions that come from it, along with our paper use. The ICS will continue to work towards ensuring accessible services and support to all throughout their digitisation. Even though great strides have been taken towards a greener and more sustainable NHS, this is a shared journey and will require collaboration across Coventry and Warwickshire. We also need your help to successfully deliver our Green Plan. As part of this, we are looking for green champions from across the organisations that make up our ICS to help generate ideas and involve our staff in our net zero journey. If you are interested in becoming a green champion, please contact us to find out more by scanning this QR code. By becoming a more sustainable integrated care system, we can help improve the health of our communities as we work through this Green Plan, target by target. Together, we can become a greener and healthier NHS.